Your nursing research course aims to prepare you as future professional nurses not only to understand but to apply the principles and methods of research in your practice. Today, we begin by discussing what nursing research is and why it matters. The Commission on Higher Education mandates that BSN graduates must demonstrate competency in research. This is not optional. This is foundational. You are expected to conduct research not just for academic compliance, but to contribute to nursing knowledge that can directly impact the lives of the Filipino people. Through research, you become more than just a provider of care. You become an investigator, an innovator, and a decision maker. Nursing research equips you with the tools to analyze problems, test interventions, and advocate for better health policies and care practices. To truly understand nursing research, we must first define it clearly and explore how it applies to our day-to-day practice. According to Pollitt and Beck, nursing research is a systematic inquiry designed to develop trustworthy evidence about issues of importance to the nursing profession. It involves the use of both scientific and critical thinking to generate findings that inform and improve nursing practice. Think of it this way. Systematic inquiry means you are not just guessing or relying on anecdotal experience. You are using a logical, structured process, whether through interviews, surveys, or experiments, or document analysis, to find real answers to problems that matter in nursing. Nursing research applies scientific methods. You identify a problem, form a hypothesis, and test it with real data. For instance, suppose you believe video-based teaching is better than written handouts for diabetic patients. You can test that idea systematically. We are not just interested in theories. We want solutions. The scientific method guides our steps so that we can ask, what's the problem? What do we want to find out? What do we think is causing it? How do we test our idea? What does the data tell us? Say, for example, you believe that educating diabetic patients using videos instead of printed leaflets could improve their compliance. You can design a research study to test that hypothesis. That is scientific thinking. And yes, nurses do that too. Research in nursing includes both qualitative and quantitative methods. If you're asking how many or how often, you're probably using quantitative methods. But if you want to know why or how people feel, then qualitative tools like interviews and focus groups come into play.
Now that we know what nursing research is, let's explore its unique nature, what makes it distinct and essential in the healthcare setting. The nature of nursing research is both scientific and systematic. That means it is grounded in evidence and follows a logical flow. We don't just jump to conclusions. We observe, we collect data, and test hypotheses step by step. It is also problem solving and action oriented. Nurses are constantly identifying problems like accidents, poor compliance, or communication barriers. Research gives us the tools to dig deeper and find solutions. Moreover, it's patient-centered and outcome-focused. Everything we do in research aims to improve the quality of care and the well-being of our patients. Our research is also grounded in theory and practice. We use nursing theories like Lorem's or Fender's to frame our questions and interpret our results in a way that makes sense for nursing. And finally, it can be qualitative, quantitative, or mixed methods, depending on what kind of problem we are addressing. No single approach is superior. The key is choosing the right tool for the research question. Let's take a closer look at where nursing research applies. Its scope spans many areas beyond the bedside. When people hear nursing research, they often think only of clinical trials, but it goes far beyond that. Let's explore the wide scope of this field. In our nursing practice, we study procedures, patient outcomes, and interventions. For instance, which type of dressing promotes faster healing in diabetic foot ulcers? Or what's the effect of the nurse-patient ratios on medication errors? In nursing education, research helps us improve how we teach. Yes, you can research how nursing is taught. Are students learning better with simulation than with lectures? How effective are return demonstrations in developing confidence? One study might ask, what is the impact of online learning on the clinical reasoning skills of third-year BSN students? That's timely, relevant, and research-worthy. In nursing administration, we explore topics like workload and staffing and leadership. Maybe your research explores the impact of shift rotations on nurse fatigue and absenteeism, or the effects of transformational leadership on staff motivation. In community and public health, we examine public behaviors and interventions. From deworming campaigns to dengue prevention, public health is full of topics. You might research What factors influence mothers' decision to seek prenatal care in coastal areas of Sarangani? In policy and advocacy, research can push for systematic change. This is where nurses influence laws and programs. For instance, research can support the extension of PhilHealth coverage for preventive services, or study how well the no balance billing policy is being implemented, or evaluate how the universal healthcare law impacts access in far-flung areas. As you can see, wherever nurses are, research has a role. By studying policy, nurses can shape the very structure that govern healthcare. To appreciate where we are today, let us take a quick walk through the history of nursing research, from its humble beginnings to its powerful role in modern healthcare. We owe the roots of nursing research to Florence Nightingale, who was considered the mother of nursing research. During the Crimean War, she collected data, used statistics, and showed that sanitation dramatically reduced mortality. She was not just caring, she was counting. And that is research. After World War II, nursing began shifting from bedside training to academic institutions. With this move came the growth of scholarly research. Nurses were expected not just to practice, but to generate and apply evidence. Today, nursing research is central to global health goals. We now focus on patient safety, health disparities, digital health, climate resilience, and community-based solutions. In the Philippines, nurse researchers explore local needs, from the effectiveness of barangay health workers to indigenous health practices. As future researchers, your task is to continue this legacy. Research is not just something that happened in the past. It is your contribution to the profession's future.